There is a seed sitting on the shelf of every grocery store in America right now. It costs less than $2 a bag, fits in the palm of your hand, and a published clinical trial from the American Heart Association showed it can drop systolic blood pressure by 10 points in 6 months. Not may support, not shows promise in preliminary data, drop it. By 10 measurable points. Results that made the researchers themselves compare it directly to blood pressure medication. And 9 out of 10 people over 60 who try it are making one simple mistake that completely wipes out every single one of those benefits. I've been in medicine for over 25 years. I've sat across from thousands of patients over 60, looked at their labs, talked through their options. And there is one food I now bring up in those conversations more than almost anything else. And most of the people I see have never heard this from any doctor, ever. Not because the evidence is thin. The evidence is as solid as evidence gets. It's because a 15-minute appointment is built around managing what's already broken, not preventing what's building silently in your arteries right now. I'm not talking about chia seeds. I'm not talking about hemp or some imported superfood in a fancy bag that costs $40 and comes with instructions nobody reads. I'm talking about ground flaxseed, the thing sitting between the granola and the oat bran in your supermarket, in a plain, unremarkable little package. No celebrity endorsement, no influencer campaign, no marketing budget at all. And while it sits there ignored, the studies keep accumulating in the world's most respected medical journals, with results that should make every cardiologist stop what they're doing and pay attention. Here is exactly what the next 15 minutes will give you. The real mechanism of what is happening inside your arteries right now. And I mean the actual biochemistry, not the oversimplified version most people have been told. Why ground flaxseed attacks that process at 3 completely separate points at the same time. The specific clinical trial numbers that explain why this works. The one mistake that cancels every benefit, and the exact dose used in the landmark study. If you have high blood pressure, elevated cholesterol, or you've been told there are plaques in your arteries, what I'm about to show you may genuinely change how you approach your health starting tomorrow morning. Before we get to the solution, I need you to understand what's actually happening inside your arteries, because most people are working with a picture in their head that is simply wrong. And that wrong picture is exactly why this disease keeps progressing quietly for decades before it announces itself as a heart attack or a stroke. Most people imagine atherosclerosis, the narrowing and hardening of arteries, as something like grease building up inside a pipe, fat clogging a drain. Simple, mechanical, predictable. That image is wrong, and it's dangerous because it makes the process seem slow and passive when it is actually fast, active, and driven by something you can influence. Atherosclerosis is a chronic inflammatory disease, and it begins with damage to the endothelium, the inner lining of your arteries. Picture a single layer of cells, thinner than tissue paper, covering the inside of every blood vessel in your body. When that lining is healthy, your arteries are flexible, responsive, able to expand and contract with every heartbeat. When it's damaged, everything downstream changes. High blood pressure damages the endothelium through sheer mechanical force. The relentless pressure of blood pushing against those fragile walls thousands of times every day. Chronically elevated blood sugar corrodes it, the way acid corrodes metal. Chronic stress floods the body with cortisol, which drives systemic inflammation that attacks arterial walls from the inside. Ultra-processed food introduces inflammatory compounds that those delicate cells were never designed to handle. Each of these is like running sandpaper along the inner surface of your arteries, slowly, every single day. Once the endothelium is damaged, it becomes permeable. LDL cholesterol, the so-called bad cholesterol, slips through and gets trapped inside the arterial wall. And here is the step that most people, and honestly, too many routine medical explanations, skip entirely. It is not the LDL itself that causes the problem. It is the oxidized LDL. When LDL gets trapped in the artery wall, free radicals attack it and oxidize it. Your immune system detects oxidized LDL as a foreign invader and sends immune cells called macrophages to engulf it. But when macrophages absorb too much oxidized LDL, they swell into what scientists call foam cells, fat-engorged immune cells that cannot leave. Foam cells accumulate into fatty streaks. Calcium deposits form. Fibrous tissue grows over the surface. The plaque grows. The artery narrows. And one day, if an unstable plaque ruptures, and the most dangerous ones are often completely silent right up until they do, a clot forms instantly. Blood flow stops. That is a heart attack or a stroke. After decades of invisible, accumulating damage driven every single day by what you eat. Now here is what makes ground flaxseed genuinely remarkable in the context of that process. It does not work through one mechanism. It attacks that entire inflammatory cascade at 3 separate points simultaneously. No other food in the scientific literature does this. The first component is alpha-linolenic acid, ALA, a plant-based omega-3 fatty acid, and flaxseed contains more of it than any other food on Earth. 2 tablespoons of ground flaxseed deliver approximately 3.2 grams of omega-3. A 3.5-ounce salmon fillet, widely considered the gold standard for omega-3, contains between 1.5 and 2 grams. Gram for gram, flaxseed has more omega-3 than salmon. This plant omega-3 reduces systemic inflammation throughout the entire body. It decreases the production of inflammatory signaling molecules that assault arterial walls. It lowers platelet aggregation, reducing your blood's tendency to form dangerous clots. It improves endothelial function, helping the cells lining your arteries produce more nitric oxide, which is the molecule that keeps blood vessels open and flexible. And it lowers blood pressure through a mechanism that researchers only fully understood in 2014. Here is where it gets genuinely extraordinary. Scientists at the University of Manitoba published research in the journal Hypertension, revealing the exact biochemical mechanism behind flaxseed's blood pressure effect. ALA from flaxseed inhibits an enzyme called soluble epoxide hydrolase. That enzyme normally destroys protective compounds called oxylipins, which naturally relax blood vessel walls. When flaxseed blocks that enzyme, protective oxylipins accumulate in the bloodstream, vessels relax, and blood pressure falls. No other food in the scientific literature has demonstrated this mechanism. It is specific to flaxseed, a biochemical backdoor to blood pressure control that researchers didn't even know existed until they started looking for it. The second component is lignans.
Flaxseed contains the highest concentration of lignans of any food ever measured. Not just the plant kingdom, any food on the planet. Lignans are polyphenol compounds with potent antioxidant and anti-inflammatory properties. What they do specifically inside your arteries is protect LDL from oxidation. Remember, it is the oxidized LDL that triggers the entire cascade. The foam cells, the plaques, the narrowing. Lignans neutralize the free radicals that oxidize LDL before they can do that damage. If LDL isn't oxidized, macrophages are not activated. If macrophages are not activated, foam cells don't form. If foam cells don't form, plaques stop growing. Lignans attack the process at its absolute root, the earliest possible intervention point in the entire disease sequence. They also directly reduce arterial wall inflammation and help shift the cholesterol balance toward a healthier ratio, raising protective HDL while lowering LDL.
The third component is soluble mucilaginous fiber, the kind that forms a thick gel when it contacts water in your digestive system. That gel acts like a sponge passing through your GI tract, binding cholesterol and bile acids and carrying them out of your body before they can be reabsorbed into the bloodstream. Your liver, sensing the loss of bile acids, draws cholesterol from the blood to manufacture more. The result is a measurable, repeatable drop in LDL and total cholesterol, produced not by a drug, but by a fiber that the seed makes naturally. 3 mechanisms, working simultaneously. Omega-3s reducing inflammation and blood pressure. Lignans intercepting LDL oxidation at the source. Soluble fiber pulling cholesterol out of circulation before it can cause harm. That triple action, that synergy, is what no other food replicates. And it is why the research on ground flaxseed keeps producing results that genuinely surprise the scientists running the studies. Let me give you the actual numbers. The FLAX-PAD trial, published in Hypertension by the American Heart Association, is one of the most rigorous dietary intervention studies ever run. Double-blind, randomized, placebo-controlled, 6 full months of follow-up. Participants had peripheral arterial disease, people with arteries already compromised. They received 30 grams of ground flaxseed per day, mixed into ordinary foods like bread and muffins. Neither patients nor researchers knew who was getting flaxseed and who was getting a wheat placebo. In patients who entered the study with high blood pressure, systolic pressure dropped by an average of 10 millimeters mercury. Diastolic dropped 7. The researchers wrote, in their own words, that this represented one of the largest reductions in blood pressure ever documented by any dietary intervention in a controlled trial. Not a pharmaceutical, a seed that costs $2 at the grocery store. A 2024 meta-analysis in clinical nutrition research, covering 5 randomized controlled trials in hypertensive patients, found a mean systolic reduction of 8.64 millimeters of mercury. A 2025 meta-analysis covering 18 studies and over 1,200 hypertensive participants confirmed significant reductions in both systolic and diastolic pressure. And the largest meta-analysis to date, 33 studies, nearly 2,500 participants, showed the greatest effects at doses of at least 30 grams per day for at least 12 weeks. This is not one promising pilot study. This is a converging body of evidence across decades, continents, and thousands of patients. I want to tell you about a patient I'll call Margaret, 67 years old, from just outside Columbus, Ohio. She came to me on 2 blood pressure medications, systolic still sitting at 152, LDL of 141. Her cardiologist was talking about adding a statin. She was already taking 6 pills a day for various conditions, and she sat across from me and said something I've heard hundreds of times. "Dr. Cole, I don't want another pill. What can I actually do?" I told her about the FLAX-PAD trial. I told her 2 tablespoons of ground flaxseed in her morning yogurt and over her oatmeal every single day. She told me it was the easiest thing any doctor had ever asked her to do. At 12 weeks, her systolic was 140. At 16 weeks, 134. LDL had dropped 21 points without a statin. Her cardiologist called me, not to write a new prescription, but to ask what she'd changed. Most doctors won't bring this up during a routine visit. I want to be clear, it's not because they don't care. The doctors I know care deeply about their patients. But a 15-minute appointment is structurally designed to manage what's already diagnosed, not to spend time explaining the biochemistry of a seed. The system prioritizes the prescription pad, not the produce aisle. That's not a conspiracy, it's a resource problem. And millions of people are paying the price for it, with their blood pressure, their cholesterol, and their arteries. This is something I wish every one of my colleagues talked about openly. So let me give you everything you need to use this correctly. Because there is a right way and a wrong way. And the wrong way produces exactly 0 results, no matter how faithfully you follow every other piece of advice. The most important mistake, and it is far more common than it should be, is eating whole flax seeds. The outer shell of a whole flaxseed is extremely hard. Your digestive system cannot crack it open. The seed travels through your entire GI tract completely intact and exits exactly as it entered, releasing no omega-3s, no lignans, no soluble fiber. You can eat whole flax seeds for months and receive nothing. The seed must be ground. No exceptions, no workarounds. Buy whole flax seeds, golden or brown. The nutritional profile is essentially identical. Grind them at home in a coffee grinder or standard blender for 15 to 20 seconds until they form a fine powder. Grind about a week's worth at a time. Store the ground flaxseed in a sealed glass jar in the refrigerator. This storage detail matters. The omega-3 oils in ground flaxseed oxidize rapidly when exposed to air, heat, or light. Ground flaxseed, left in an open container on a kitchen counter, loses its benefits within days and can turn rancid. Grind fresh. Store cold. Use within 7 days. And do not purchase pre-ground flaxseed sitting in transparent packaging on a supermarket shelf for weeks. By the time you open that bag, the omega-3s are already oxidized. You are buying the label, not the medicine. 20 seconds in a grinder at home is all it takes. The dose used in the FLAX-PAD study, the one that produced those 10-point blood pressure drops, was 30 grams per day. That is approximately 2 level tablespoons. Begin with 1 tablespoon daily for the first week, while your gut adjusts to the increased fiber. Move to 2 tablespoons in week 2. If you notice mild bloating or gas in the early days, that is completely normal. The fiber is feeding beneficial gut bacteria, and they are recalibrating. It resolves on its own within a few days. How do you incorporate it? Ground flaxseed has a mild, slightly nutty flavor that disappears into almost any food. Stir it into morning yogurt. Mix it into oatmeal or eggs. Add it to a smoothie, a bowl of soup, a salad. It doesn't change the taste of anything. There is no recipe to learn. No elaborate preparation. It is 2 tablespoons into whatever you're already eating. That is genuinely the entire protocol. Drink a full glass of water with your daily flaxseed and stay well hydrated throughout the day. The mucilaginous fiber needs water to form the cholesterol-binding gel that produces results. Without adequate hydration, the fiber can actually cause constipation rather than improving digestion. Water activates the mechanism. Consistency is the non-negotiable variable. The research is clear that the most significant effects build over 12 to 20 weeks of daily use. Flaxseed is not a supplement that rewires your biology in 3 days. It is a food that gradually remodels the biochemistry of your vascular system, week by week, month by month. The patients in the FLAX-PAD trial who saw the greatest results were the ones who did not miss a single day across 6 months. 1 tablespoon today and nothing for the next 2 weeks does not work. Daily consistency is the dose. 2 precautions worth knowing. If you take anticoagulants, warfarin, Eliquis, or similar blood thinners, talk to your doctor before adding daily flaxseed. The ALA in flaxseed has a mild antiplatelet effect that, combined with anticoagulant medication, could potentiate bleeding risk. It's not a reason to avoid flaxseed. It's a reason to inform your physician and monitor your levels appropriately. If you're on blood pressure medication, flaxseed may enhance its antihypertensive effect. Many of my patients have been able to reduce their medication dose under physician supervision as flaxseed's effects accumulate over months. But if blood pressure drops too far, you may experience dizziness or unusual fatigue. Let your doctor know and check your numbers at home. Ground flaxseed will not replace your prescriptions. If your doctor has you on a statin, an antihypertensive, or a blood thinner, keep taking it. Flaxseed works alongside medication through entirely different mechanisms, targeting the upstream causes that most drugs don't address. The goal is not to replace what medicine does well. The goal is to add what medicine doesn't have time to tell you about. 2 tablespoons, ground fresh at home, stored in a sealed jar in the refrigerator. Eaten daily in whatever you're already having for breakfast or lunch. 12 weeks of consistency before you expect to see measurable changes. That is the entire protocol, backed by the FLAX-PAD trial, confirmed by multiple independent meta-analyses, and available at every grocery store in America for under $2. Take this information to your next appointment. Show your doctor the FLAX-PAD study. Ask about ground flaxseed. Ask about ALA, about lignans, about soluble fiber and LDL oxidation. Because the research says the answer to your blood pressure may genuinely be in the grocery store, not the pharmacy, and it has been sitting there all along, waiting for someone who knew what it was capable of. If this video helped you, share it with someone managing blood pressure, dealing with high cholesterol, or trying to protect their heart without adding another prescription to their morning routine. And subscribe and hit the bell if you haven't already. I put out a new senior health video every single day. Information your doctor cares about, but simply doesn't have time to cover. I'll see you tomorrow.